No, I don't know. It's got a microphone.
It's okay. Okay. As long as you hear me, that's fine. Okay. And I've been asked to say something about the health implications of the sleep disturbance due to vibration from rain. And this is a very difficult picture to paint since data is very fragmented. So I'm trying to give you trying to give you bits and pieces in this picture. So hopefully we can sort of paint this picture together at the end. And I'm starting the night noise guidelines for Europe, which is a very comprehensive document on how sleep disturbance is affected by noise. And where it's clearly stated that sleep is a biological necessity, which is important for many different health outcomes if it is disturbed. And one knows from other areas of research, which is not involving noise, that sleep loss is related to metabolic and endocrine functions. There's a risk for obesity, type 2 diabetes. There's an increase of inflammatory markers, which is a consequence for the risk of cardiovascular health outcomes. And it affects memory, cognition, mood, and well-being. So it's important to sleep. And when it comes to noise-disturbed sleep, in this document, Night Noise Guidelines, these are the areas where they state that there is threshold levels. There are threshold levels where there is sufficient evidence. And these, as you can see, there are these kind of biological effects, change in cardiovascular activity, which is not giving a threshold, but e.g. awakenings and those other effects that Mike talked a bit about, sleep quality and well-being. These are the outcomes where there is where the effects, there is limited evidence. And I just marked the ones with hypertension and myocardial infarction. In this document and also in other documents, it's important to state and important to stress that we do have vulnerable groups that have a risk to have a sleep disturbance may be more serious for these groups, or it is the case that they are also more easily disturbed in their sleep. And these risk groups that are pointed out are children and elderly people, pregnant women, people with ill health, some kind of chronic ill health, and also shift workers. So to paint this picture, one has to bear in mind that there's a lot of data on transportation noise. There's less on rail noise, and then there's very little on rail vibration. And this is the study that James talked about before, or was it? Yeah, about in the Clairvaux-Bronick study, which was then a combination of rail and road. But this picture shows this activity and sleep disturbance response curves that were formed nicely here. And this is a bit difficult to see all this, but in these curves are wakes too early, rest disturbed, wakes at nights, and difficulties going to sleep. So there are some curves that have actually addressed sleep disturbance in relation to vibration in the home. And then this is a Salford study which had the question on disturbance. Are you disturbed in your sleep by vibration? And then it's a Tvane study which where there are not really dose-response curves, but where one has looked at sleep disturbance in the fields that Mike talked about previously. So what can we then learn apart from this, from available data? Well, we can look at data where one has looked at sleep disturbance and on cardiovascular effects in the lab to see how do rail noise affect sleep or cardiovascular reaction. And this is a study by Griefenthal, where you can see that this mean percentage of awakenings, and you can see that rail vehicles cause a larger percentage of awakenings, a bit what Mike said before. And they could also find that there was a higher amplitude of heart rate from the rail vehicles compared to the other transportation. And this is not, of course, in accordance with the dose response curves that we have for annoyance for these different transportation sources. So that is also something that makes this picture more complicated, I would say. And there's also another study which found the same thing about the heart rate amplitude being more affected by with increasing noise levels from railway. So seems to be some data supporting this. There's also some data showing not just that freight noise may cause more annoyance, but also that it causes higher heart rate amplitude. And this is the study by Tassi, which is an experimental study again, which we see higher heart rate amplitude from freight trains compared to automotive and passenger trains. So, and this was also seen in the study by Saremi, that the freight trains cause a higher physiological response during sleep. And now we're talking about noise. So, habituation, yes, there's not that much habituation seen on physiological data from the available study, and there's not that much available data on this. But in this study, which was Tassi, this was a study where they looked at people who lived in quiet areas and in noisy areas when it comes to railway noise. And they took them into the lab and to see how they reacted to this railway noise in the lab. And then they could see that people who lived in a quiet area, they reacted a bit more strongly in the lab compared to the ones that lived in the railway area for a long period. So there seemed to be some kind of habitation from this study. So if we then come to cardiovascular outcomes, what the long-term effects are, of course, of very high implications from a health point of view, even though just sleep disturbance and being very tired in the morning is serious enough. And then there are these 4 studies that I could find. One study done in Sweden, on the west coast. This was done together with Levi Örström, where they found no association with cardiovascular outcomes and railway noise. There's a study in Switzerland where they found positive association with hypertension. I think it was subjectively reported. But these are very low noise levels. When you look at that article, it's very low noise levels. So I don't know how much we can learn from this. There was a tendency to increase risk for self-reported hypertension if the levels was about 60 dBA outside the building. This is done in Denmark. And then there's a weak positive association if the levels were above 50 dBA. That's a study done in Sweden. So weak associations, I would say, and very difficult to draw any conclusions from these data. We did see heart rate response, which was quite clearly related to amplitude in the vibration area. We did not see an increased heart rate response with an increasing number of trains. There was no effect of the number of trains in the heart rate response. So the subjects reacted at a very low level. If you remember Mike's data, where he said the lowest vibration level was more or less above perception threshold, if we should rely on those perception thresholds, and that's another probably European project. But so even if you have low vibration, we see a heart rate increase. What more can we derive from our data? Well, definitely that there's a relation with vibration amplitude with sleep quality, and that there's tendency for a number of trains, although not a large effect or no effect at all of increasing it to 56 trains as compared to 52 trains as compared to 36 trains. But that's just one study. And also that vibration per se suggests affect sleep quality equally much as noise plus vibration. Yeah, so vibration per se is an important factor here. And as you can see here, this is very clearly, I think, these data, because before we did this study, we thought, I wonder if people can actually differentiate between noise and vibration. You know, pure. But and when we asked them about vibration, this is the mean vibration disturbance, and this is the noise only. And you can see it's very low vibration disturbance, and this is the vibration only, which is clearly much higher. And you see the reverse picture when you look at noise disturbance with noise only, and this is vibration only. So it's very clearly the case that they could differentiate in the lab. If we then dare looking at our dose response, which are based on such a limited study, even though it's a very large experimental study, it's still limited data. If we start to look at how does this relate to the field data that Sabine has derived, and this is very preliminary data. We can see in the Bosch from the freight, this is annoyance to sleep disturbance to the freight trains. And the red dots are our highly disturbed, and these are the disturbed. If we can see, these levels are not so far from your highly disturbed. We can also see that we are in the low range of your dose response curves. And if we go to the Radchinkov data, the Polish data, which is only freight trains, which makes it more interesting, I think. Then if we look at our highly disturbed in the lab, it looks quite neat. Mm-hmm. But again, limited data. So my concluding thoughts about this is that it's quite clear that vibration, in addition to noise, causes a higher noise, and probably also sleep disturbance. So any guideline or any kind of way of dealing with vibration would be that any guideline that's applicable for noise, if we have vibration, it needs to be stricter. That's something that's a fair guess. And in addition, available data show that freight trains causes a greater physiological reaction and probably also higher annoyance. So that is another factor that we need to take into consideration. That's where I want to stop. Thank you.